Welcome back to the CCBC Virtual Library and Nursing Enrichment Part 2. I apologize for ending the first screen video rather abruptly, limited on my time with these, so and I seem to have the gift of gab. I think I said I did kiss the Blarney Stone in 2004. So anyhow, we'll start back where we left off with the PICO questions. As we said, we'll go ahead and look again at those elements. And again, this is something that in the past has appeared on the NCLEX exams. The elements of PICO are the population, intervention, comparison intervention, outcome, and a time frame. So here's the same question we did right before we signed off. In hospitalized adults, how does a rapid response team compared with no rapid response team affect the number of cardiac arrests and unplanned admissions to the ICU during a 3-month period? So when we look at this, we just tear it apart. What's the population? Hospitalized adults. Intervention is the rapid response team. Our comparison, there's no rapid response team, so there's not always that comparison there, and that's not always stated. And our outcome is the number of cardiac arrests and unplanned admissions to the ICU. And we do have a time frame of 3 months that's definitive, not the clinical questions aren't always specified like that with a time. So there we are. It's pretty common sense. And now we'll look at a second question so we just get the hang of it. In men, does having a vasectomy increase the risk of getting testicular cancer in the future? So our population here is pretty straightforward. Men. What was the intervention? Or that could be men who had vasectomies, but we're going to say the intervention is the vasectomy. And our comparison, no vasectomy. Outcome, testicular cancer, or time, it's a vague future. So that one was pretty easy to dissect also. So just remember, there is a purpose for this. When you come up with that clinical question, these terms will help you search for research. So, and you want to remember that you'll use synonyms and replace terms, just like when you do any other search for literature or any other subject. So I'm going to have you develop a question. So this is my little cousin from Southern California. She, at 8 months old, they discovered that she had a cancerous brain tumor. Now, she has gone through several chemotherapy protocols, and even since she was an 8-month-old, her team of oncologists at Kaiser Medical have integrated cannabis oil into her protocols. So they did that for 2 reasons. The chemotherapy regimens, as we all know, often make people very sick and nauseated, and so the medical marijuana was thought to be something that would alleviate that. And on a secondary note, they were doing a study to find out if the cannabis oil also caused tumor death. There was some reason to believe that may be so. But for us, we're going to do our clinic, and she is doing very well. She's 7 now, and she's leading a pretty normal life right now. And so we're very blessed. Now, our question is going to be, we have to look at our population. Our population, pediatric cancer patients, children with cancer. Also, they're undergoing chemotherapy. So if we're going to do the nausea and vomiting question, so the intervention in Sophie's case was cannabis oil. Comparison, we didn't have one, but if we were the oncology nurse and we were looking at a floor of pediatric cancer patients undergoing chemo, we might want to compare ginger or antiemetics to see what the studies are showing, and the outcomes, nausea and vomiting. So there we have all of our key roles to our clinical question for when we do our research. So I bet you've done very well. All of the nursing students really excel at this in class. So I want to congratulate you for getting this far with me on my pilot of library instruction online. So remember those PICO terms. And the next thing we're going to look at, and we're still building that foundation for your assignment so you can go into those databases and know exactly what you're doing and why you're doing it and why you're integrating research into your nursing. So, and we want to realize that there is a hierarchy of evidence. So where are you getting these studies? These studies are going to be publicized in nursing journals, and they must be peer-reviewed journals. And that means that they're scholarly, they've been reviewed by experts in the field and approved. So that gives you your credibility. You're not going to want to use, as we said before, studies that are not at that quality evidence level. And there actually is a pyramid that shows a variety of studies, and you don't have to memorize this, but it shows the evidence-based practice pyramid, and you'll see there are more studies at the lower end of quality of evidence. For example, background information, you could have a surgeon from Johns Hopkins who is very well versed in prostate surgeries. He may have done thousands and thousands, and his expert opinion is definitely credible at a certain level, but that's not what you would be using to integrate into your practice ideas. It might be a lead to it, but you want to go to the higher quality of evidence. And at the very top, you'll see systematic reviews that take these studies here and combine them and come up with the trends and the, like I said, meta-analysis, systematic reviews that would institute change in nursing practice. Again, you don't have to memorize this. This is out there for you. And once you are looking for your studies, depending on the kinds that you're looking for, I can help you. Now, I am going to stop here, and I'm going to have you look at a video, which this is the video, but I'm going to put it on the website right beside the installments for this library instruction, so you can listen to it and then we can come back together again. So thank you for your patience, and I'll see you in a few minutes.